wellness revolution starts now.
Welcome to the program. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. Today, we are going to discuss a topic that may be a little bit embarrassing for some people, or they may not even bring the topic up to their doctor, but it's very obvious, and it's hair loss. So there are many reasons why we tend to lose our hair. Obviously, with age, there are things that change, like hormones. We'll talk about nutrient deficiencies and some other items that really do accelerate hair loss. But importantly, we want to talk about a compounded option that we offer at Physicians Preference Pharmacy for hair regrowth. So we are going to talk about a special proprietary formulation called the hair support formula to help decrease hair loss and increase hair regrowth, because this is a multifaceted issue. So did you know that more than 35 million men and 21 million Americans, female Americans, experience hair loss in some capacity? As I mentioned, with age, it tends to accelerate, but we're going to talk about an option that, again, is proprietary. It's got a special blend of different compounded active ingredients in it that allow us to address not just the hair loss, but to promote regrowth as well, because this is a constant issue for a lot of folks that come into our pharmacy and see our physicians. So this specific formulation contains 3 primary active ingredients that we're going to unpack how they work and why they're in there together to work better and stronger together. The first ingredient is a peptide called GHKCU. The second ingredient is a hormone called progesterone. And the third ingredient is one that is not new to the market, but is getting a lot of extra attention in the last few years, and that is called rapamycin or sirolimus. So again, these specific ingredients help to address hair loss and to encourage hair regrowth. So first off, let's talk about some of the common causes of hair loss. Other than age, other than stress and the typical changes in hormones, there are some other issues that can be impacting the overall system, take a threat to the immune system, and cause inflammation that can accelerate hair loss. Family history, we oftentimes do see this run in genetics. Hormonal imbalance, stress, thyroid issues is a big one. Whenever we talk about hypothyroidism, or thyroid dysfunction, one of the first things that always comes up in conversation is hair loss. Brittle hair, brittle nails, excessive hair loss. So that can point to an underlying thyroid issue. Also, vitamin deficiencies, vitamin A, vitamin B, vitamin C, vitamin D, iron. So many of these nutrients can be found in our foods. And if we are not getting ample nutrition through those foods, then we need to seek out appropriate doses of both vitamin and mineral supplementation. Remember, we don't have to get crafty with the way that we address underlying issues. We just have to understand what that underlying issue is and go after it directly. If we think about the building blocks that are necessary to help grow hair, it's amino acids, it's protein, it's nutrients. So chances are a lot of that has to actually do with nutrient deficiencies. Additionally, after COVID, we have seen very accelerated hair loss for folks, and I don't know what the connection is, but almost 10 times out of 10, the people that experience the most hair loss are women with thick hair. And so for these women, it's a very different experience for them because they're used to having that full head of hair. So they definitely want to do something about it. I see that over and over again. Again, the reason behind that, I'm not entirely sure. But we have had a lot of women utilize the hair support solution, as well as men, to address with post-COVID hair loss. Remember, the COVID infection, a viral infection, is not only an insult on the body, it also causes excess and prolonged inflammation. So it is putting the body in a constant state of stress, trying to fight off the inflammatory burden. It also hijacks the mitochondrial function and energetic supply from the cells. By doing that, it cuts off energy supply to the rest of the body. So your body is going to prioritize what is most important. Preserving cellular function at the end of the day, having hair on the top of your head might not be your body's number one priority. But as we lift off some of the burden on the immune system and at a cellular level, it allows your body to resume those auxiliary functions like hair regrowth. So when we talk about addressing hair loss, we again want to focus not just on why the loss is occurring, but how we can also promote hair regrowth. So just like hormonal cycles, hair regrowth, regeneration of new cells, new tissues, this actually happens in a cycle. So when we think about hair growth and we think about proper hair shedding, which is a form of hair loss, obviously, that is a normal cycle that happens, but we do not want to have excess shedding or excess loss. So when we put our heads together to create this proprietary formulation of this liquid that goes on the scalp topically, we had to think of different options that not only decreased hair loss, but also promoted hair growth. Again, we know that inflammation is oftentimes underlying root of all disease, dysfunction, or imbalance in the body, and the scalp is not excluded. So when we have excess inflammation at the follicle level, on the scalp, it is going to strangulate the follicles, causing some of those follicles to fall out. And we want to, of course, preserve those. So let's break down the actual ingredients that are present in this formulation. Number one, GHKCU. So GHKCU is what we call a tripeptide or a copper tripeptide. GHK are 3 amino acids, 1, 2, 3, and it's physically attached to a copper molecule. It's naturally present in the body. We're just replacing it, but topically. The copper allows those amino acids to be driven further into the cell, making them more bioavailable. And GHKCU naturally in the body is responsible for providing antioxidant benefits, anti-inflammatory benefits, improving collagen, replacing tissue, repairing tissue, and also bringing circulation and blood supply to the area. Oftentimes, we will hear about success for folks that use this product topically in conjunction with red light therapy devices that hit on the scalp directly, because the GHKCU ingredient in here, in addition to red light therapy, both increase circulation to the follicles and to the scalp, allowing them to work best and synergistically together. Also stimulates collagen repair and, again, nourishes the follicle. So we are really promoting hair regrowth in this instance with the GHKCU peptide. It also extends what we call the anagen phase, which is the growth phase of the hair cycle. We're always trying to identify where the issue is in that hair cycle so that we can fix it. So takeaway, we get longer, stronger, and shinier hair. GHKCU can actually provide some UV protection for your existing follicles as well. Now, one note on the formulation of GHKCU. So there's a lot of ways you can get it in the body or on the body, but for GHKCU to be specifically helpful for hair regrowth, it needs to be applied topically to the area that is affected. So for men and women, we have different types of hair loss patterns. So it's going to be specific based on the sex of the patient, where it goes on the head, but most importantly, where that loss is occurring. Progesterone. So we typically think of progesterone as a female hormone, but that's not true. Actually, both men and women carry certain amounts of progesterone. It's just that women have a lot more fluctuation and higher levels of progesterone, which of course have very important roles in cycling each month, birth, etc. That being said, across the board, male or female, progesterone is really important for controlling inflammation, for keeping the brain and the body calm and resilient to stress. It helps to prepare mind for sleep at night. These are some of the reasons we use it in our oral formulations. But one of the forgotten benefits of progesterone, especially when it's applied topically to the scalp, is it is referred to what we call nature's DHT inhibitor. So in the body, you have levels of your testosterone hormone flowing about. A natural process is that testosterone uses an enzyme called 5-alpha reductase to break it down to something called DHT. However, with excess levels of DHT accumulating and rising in the body, it can perpetuate hair loss. So if we can cut off that enzymatic reaction or decrease how much of the testosterone gets converted to DHT, we can decrease the rate or the amount of hair loss. So we've already addressed hair regrowth with GHKCU. Now we're talking about minimizing hair loss with progesterone. Some oral options of 5-alpha reductase inhibitor drugs would include finasteride and dutasteride. They can be used as oral formulations. However, they can carry more side effects of those drugs than if we're using something topically. So this is a nice option for those that want to avoid those systemic side effects, because when this product is applied topically, we do not get systemic absorption. And the whole point is for it to just simply saturate the follicle. Now, again, by lowering DHT, those follicles can re-enter growth mode. So decreasing hair loss, increasing hair regrowth. So we talked about the benefits of topical delivery, specifically not to be confused with other dosage or routes of administration of GHKCU. We want to be sure to apply it topically to the scalp. Third, rapamycin, also known as sirolimus. So rapamycin has been around for a long time. It's known to give a lot of anti-inflammatory benefits. It's really come on the anti-aging scene, especially when it's taken orally. However, science is showing, literature is showing, that it probably has a space in the hair regrowth industry. It's currently being studied. The way that it works is it is functioning as an mTOR inhibitor. So mTOR stands for the mechanistic target of rapamycin. And what that pathway does in the body is it is very specific for decreasing inflammation, also promoting something called cellular autophagy, which is routine cellular housekeeping. So if you think about taking your trash out of your house once or twice a week, taking it to the curb, and they take it away, that's proper routine cellular housekeeping. If you just choose 1, 2, 3 times a week to take your bathroom trash and throw it in the living room, take your kitchen trash, throw it in the upstairs bathroom or in the bedroom, things get messy. So when cellular autophagy or cellular housekeeping breaks down in the body, which is exactly the impact that a COVID infection has on the cells, things start to not function as smoothly. When that happens, we get excess toxins that build up, excess stress, excess inflammation. And again, your body's just trying to keep you alive and prioritize. It's not really trying to hang on to your hair. So we do love including that rapamycin here in this topical formulation because it can also rejuvenate some of those follicles that have gone dormant. Also, it does improve cellular turnover on the scalp. So that might not sound like something that we want, but again, we're talking about the balance between follicle or hair turnover and cellular turnover. We do want healthy cell turnover all the time because if we get excess skin growth or we get excess inflammation, again, those hair follicles will be strangulated and they will fall out. So we want to be sure that we have that consistent turnover all the time. So just a couple of housekeeping items, if you will, of other things that you can do to address or help to prevent against hair loss would be just taking an inventory of your everyday lifestyle, maybe some products that you're using, etc. So when we think about healthy scalp habits and some of the things that we can do in our day-to-day life, we have to talk about nutrition. Again, getting ample protein. This is something you have to either work with your nutritionist or your physician on to be sure you're getting enough to meet your bodily requirements based on your activity schedule, if you have more of a sedentary lifestyle, etc. Also, stress management. It's almost laughable to talk about that because many of the stressors in our lives are not controllable. They're not something that we can change. However, we can do certain things to mitigate the effects of stress so our body doesn't always feel like we're in fight or flight mode and again, just trying to keep us alive. So, meditation, prayer, quiet time, taking yourself out of these stressful situations. Again, it's not always avoidable. However, if you are mindful of that, you always have opportunities to cut some stress out of your lifestyle. Also, what about topical products? So, for women, it's less likely that they wash their hair on a daily basis. Men typically do, but that being said, shampoos conditioners, hairsprays, hair products are usually something that most people are using on almost a daily basis. Some of the very offensive ingredients that we may find in these products can include formaldehyde, parabens, and fragrances, just amongst a very long list that can do what? Cause inflammation at the scalp, which may affect or drive hair loss further. We talked about nutrition, we talked about stress, we talked about some of these topical products. So again, just take an inventory, see what's going on. Whenever we have a condition that seems that it's ongoing or not treatable, the easiest thing that we can do is look at what we're doing on a daily basis and either minimize that or make some very small shift. If we cannot address it with those changes, that's where something like this, like a topical compounded product, comes into effect. So I want to encourage you to be sure that you get with a physician that understands what some of these root cause issues are so that we can address it and not only take an inventory of those lifestyle habits, but if you're looking to address hair loss and increase hair growth topically, let's talk a little bit about how to use this product. So this is a compounded only, prescription only product from Physicians Preference Pharmacy. Again, it's a proprietary formulation. So it's made in a base that's a little bit thicker. It has a nice scent to it. And it's prepared in a base that allows it to, again, saturate the follicle. So you apply this liquid to the affected area of the scalp or the bare thinning spots on the scalp at least twice daily in most instances for the first month or so. And then in many cases, you can probably back it down to just once a day. You do want to be sure to separate it, ample time from washing hair, going swimming, sweating excessively, using other hair products. This personally is not one product that I have used. However, for many folks that have used it, they've reported to me it does not make their hair oily. It does not leave any type of a texture in the hair, so it goes in quite nicely, and you can use your typical products, hair drying, washing, all of your normal hair care accessories over this product. Again, just timing of when you use it is most important. We also have a lot of folks that do use it prior to bedtime, and they sleep on it with causing no issue on the pillow. So just to recap, for this compounded product from Physicians Preference Pharmacy, the hair support solution has 3 primary ingredients. The peptide GHKCU, which is a tripeptide copper formulation. We also have progesterone, which is nature's DHT inhibitor, so it helps to stop some of that hair loss and decrease inflammation. And lastly, rapamycin, which helps to decrease inflammation at the hair follicle. So we're trying to address this from a synergistic perspective. How do we decrease hair loss and increase hair regrowth? So again, it is by prescription only. Please talk to your physician about writing this for you if you are having consistent and chronic hair loss, and if you've not recovered post-COVID infection, or if you are addressing your hormones, but still hair loss is a primary issue for you. Please feel free to give us a call at Physicians Preference Pharmacy. If you have any questions for any of our pharmacists, we would be happy to speak with you. Our phone number is 281-828-9088, and it would be our privilege to serve you. At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.